Out-of-pocket healthcare expenses after the age of 70. So listen here, my friends. I don't know if I can put the link in the show notes. I can put the PDF in the show notes, which I think I can. Find this through Google Scholar and download it and save it to your hard drive, because I could not find it on the EBRI website anymore. In fact, I don't know if I can do that. Let's see if we can bring up I'm not sure if I can do that. All right, let's stay here because I might screw me up. So anyway, if you go to EBRI and you type in and cut and paste this right here and you put it on there, you won't find this. It'll show you dead links, which concerns me a little bit. Now, I've talked about this before, but I'm going to talk about it again because this is why. Look, man, this is why the whole issue of the healthcare crisis and retirement is nuts. All right, and I talk about this in my book. So back on the shelf back there. The one right over my shoulder right there. You can retire on Social Security. All right. So Sudepo Banerjee, he works over at UCLA, is my understanding, as a researcher economist. He wrote this on behalf of the EBRI. So this is Dateline off April 2018, so just a year and a half ago. So this study estimates how much retirees spend on out-of-pocket health expenses after the age of 70. Unlike many studies, it includes only expenses for healthcare services actually used, i.e., Medicare and insurance premiums are not included. So Medicare and here $135 for Part B and whatnot are not included in this. I just cannot stress this enough. One of the reasons EBRI, I think, took it off their websites because people thought this included Medicare. It could not state it more clearly. It does not include your Medicare premiums, all right? So your Part B, Part D, and Medigap, or if you have Medicare Advantage, are not included in this expense. The expense is solely for out-of-pocket healthcare expenses after the age of 70, i.e. long-term care in particularly, in-home healthcare. It is based on self-reported expenses of actual retirees and not on projections of hypothetical individuals. I'm so sick of software projections because everyone uses them and we don't know what they're putting in there. It's just, I'm sick of it. The numbers are adjusted for medical inflation and reported in 2015 dollars. The self-reported expenses are from the H&R Health and Retirement Studies from the University of Michigan, which is the asset and health dynamics among the oldest ahead cohort. Here are the key findings. For the majority of surveyed people, out-of-pocket healthcare expenses are not as high as commonly believed. For those who die at age 95 or later, the median cumulative out-of-pocket expenses after the age of 70 is slightly above $27,000. So by the time you go through 70 years old and you die after the age of 95, the median, 50% have more, 50% have less, is $27,000 for out-of-pocket healthcare expenses, i.e. I'm hiring a lady to come into my home and change my diaper or something like that. But these expenses are catastrophic for some. Again, those who die at 95. So we're taking a cohort at age 95 or later, not after 95, age 95 or later. We're taking a cohort that lives a long time. The vast, vast, vast majority of us will not. The 90th and 95th percentile. So we're taking a cohort of basically of the 2 percentile or the 98th percentile of age of how long you're going to live, if even that. And then we're going to say the 90 and 95th percentile of that 98th percentile, and I don't know if it's actually 98th, it might be 97th, but still, the 98th percentile, the people who live beyond 95, we're taking the 90th and 95th percentile of that 98th percentile has out-of-pocket, have nearly, respectively, have the 90th and 95th percentile are nearly 172 and 269,000 respectively. So if you live to 95 and you're in the top 10 or 5% of most expensive people with out-of-pocket expenses in healthcare, even then it's only 172,000, 269,000. In other words, the distribution of cumulative out-of-pocket expenses is skewed towards those with higher expenses, without question, which means we want to do the median, not the average for sure, all right? Nursing home expenses are the biggest contributors driving the skewness of the distribution. Without out-of-pocket nursing home expenses, the 90 and 95th percentile of those who die at the age of 95 or later drops to nearly 96,000 and 154,000. So again, we're taking 98 percentile, the people who live to they're 95 years old or longer. Within that tiniest percentile, we're taking another tiny percentile of them, the 10th and 5th most expensive people. And we're saying if that is them, they're going to spend $172,000 or $269,000. If they don't go to a nursing home, they're going to spend $96,000 to $154,000. Again, it's catastrophic in some regard, but just for that select group of people. Thus, what's the likelihood of you really having some significant debilitating expense? It's not high. It's just not enough to worry about where you stay at work for another 10 years. For all surveyed people, this is everybody, the median out-of-pocket cost is zero. But just like the distribution of total out-of-pocket healthcare expenses, the distribution of nursing home expenses is also skewed towards those with higher expense, which means a small percentage of retirees face a very high expense. For those who die, we already talked about that. For those who die at age, okay, we already talked about, but the sample is restricted to only those who enter a nursing home. The 90th and 95th percentile is 182,000 and 266,000. The significant difference between men and women. Women are slightly more likely to enter a nursing home versus men after the age of 70. 38% of men do, or 51% of women do. All right, after the age of 70. Women also live long enough to spend significantly more than men with similar lifespans. For example, the 90th percentile of out-of-pocket expenses for men and women who die at the age of 95 or later is about 22% more for women than men. Longevity has a positive correlation with nursing home entry. That makes sense. Total out-of-pocket health care expenses and out-of-pocket nursing home expenses. So the longer you live, the more likely you are you're going to go to nursing home, have higher out-of-pocket health expenses and higher nursing home expenses. So you should take up smoking. 1 of 3 of the surveyed retirees are covered by Medicaid after the age of 70, which means 2 of 3 are not. The cumulative numbers for the age 70 to death should be interpreted more as a lower bound than a true estimate. A slightly better measurement, as described in the section down below, though not perfect, might be the average annual out-of-pocket healthcare expenses, but the distribution of average annual expenses is also rightly skewed and retains all the characteristics of the accumulation. So they're saying the cumulative expenses and the average is distributed heavily towards the skewed on the right, i.e. a few people spend a lot and most people don't spend hardly anything. The median, 90th percentile and 95th percent, this is all that matters in my opinion. The median, that's 50% more, 50% less. 90th percentile, the 10% most expensive, and 95th percentile, hey, come here, hold on a second. Median, 90th percentile and 95th percentile, that's 3 different cohorts of average annual out-of-pocket expenses for the entire sample is $2,000, that's the median. All right, so the median for the entirety is $2,000, $11,000, and $19,000 respectively. It's crazy, and that's real live numbers here too. And here's he served as they talk about Sudupi. Sorry, I'm not pronouncing his name right, but I apologize. I want to go into, hold on a second. Here are the components of out-of-pocket healthcare expense. The first thing that jumped out at me was dental services. All right, so the dentist is not covered by Medicare, so you're going to have to pay for that. We got home health care, those 2 things, that makes sense. Doctor's visits, some of the Part B would be paid by physician services, but you're going to have other expenses that Medicare doesn't pay. Nursing home stays, we already talked about that, but the prescription drugs, hospice care, special facility or services such as adult daycare, social worker, outpatient rehab, physical therapy. So when I was getting my PT, a lot of older people in there, for sure. Someone's paying for that. So if we separate nursing home expenses from inpatient hospital expenses, I'm not going to do all that here because I've done this before, but I'll put the link or the PDF in the show note. If you don't go to a nursing home, the likelihood of you having major expenses is low. Going to a nursing home is expensive, no other way around that. But what's the likelihood for that happening? Not very high, okay? Because we're just showing, or in terms of not very expensive. I wonder if they show, I do want to show you right here. All right. The study uses data from the HRS, the Health and Retirement Study. In particular, use a cohort of the asset health. We are talking about a head cohort of HRS used for the study. Head members were born before 1924 and were at least 70 years of age when they first interviewed in 1993. So we followed these people. After the first interview, they were interviewed in 1995, 1998, and every 2 years thereafter. The initial sample size was 8,300 people, so it's a statistically significant sample size. The sample excludes spouses of head members who are below 70 at the age 70 in 1993. By 2014, 19 members of the head cohort were dead. All right, so what we're showing here is there's 8,335 in 1993, the initial sample size, and 21 years later, that's about 75% were dead. This is the final sample size as this study focuses on the dead members of the cohort and accumulates their out-of-pocket health and care expenses. Because some members of the members included were above the age of 70 when first included in the survey in 1993, the cumulative out-of-pocket expenses might be missing for some of the years between when they were 70 and when they were first included in the survey. So the cumulative estimates should be treated as a lower bound, and a better measure might be the average, which you already talked about, which wasn't much. Apart from the information obtained using the core HRS surveys, data were also used from exit interviews in which generally either their surviving spouse or children provided critical information about healthcare services used at the end of life for the patient, and reported real dollars in 2015 and adjusted for medical inflation. So the issue here is the children or the spouse, who certainly know better than the patient, would know what the costs were. And what they're saying, like, I'm not going to read this whole thing because I've done that before, but it's incredibly informative, and that's why you got to get a copy and save it. But what they say is, at the end of the day, let's go back to the median at the 90th and 95th percentile. All right, so we go back to the median right there. The median, the 90th and 95th percentile of average annual out-of-pocket expenses for the entire sample size: $2,000, $11,000, $19,000. I rest my case. You can retire. All right, we'll see you.